Fab. I'm just going to start trying to share this live because it takes a while to load.
No problem. Okay, everybody. So this is the last webinar for today. So we've got Lois here who will introduce herself in a moment. Like I say at every webinar, so you might be fed up of me saying it. All these webinars will be on the Facebook page for you to watch later and share with your colleagues. So, because we know everyone's so busy, you can watch them at another time. We also ask if you just go on to mute so there's no back noise. And if you've got any questions, any comments, it's great for a good interaction. If you all, please do share anything that you're also doing, because I'm sure you'll be hearing lots of things from Lois and be having things to add as well. And we will add a little evaluation link at the end for you just to complete a little evaluation about each of the webinars. Each webinar has its own link. So I'm going to put myself onto mute and turn my camera off and hand over to Lois. Welcome, Lois.
Thank you, Sue. Thanks everybody for joining. I like to keep it, as Sue said, I like to keep things quite informal. I always do when I'm presenting, so just shout out at me. I can see most people's your little dots above the screen. Can everybody see the first slide okay? Is that visible? Yeah,
I can. Thank you.
Perfect, lovely. So thanks for inviting me to take part in your webinars for Icon Week. My name's Lois Fisher. I'm the Deputy Clinical Lead for the 0 to 19 Healthy Child Programme across Cambridgeshire and Peterborough. I'm a midwife by background and health visitor. And I know, as much as anybody here, how perfectly placed, for those who work in health visiting, how perfectly placed health visitors are to support parents to make that transition to parenthood in whatever form that takes. Transition to parenthood can be one of the most physically and emotionally challenging
It's not
times.
moved on if you've just pressed it on.
No, not yet. I haven't moved on yet.
I saw you move and I thought, have you pressed it on?
No, it's my notes. Thanks, Sue. It can be really challenging, both emotionally and physically, in anybody's life when they're making that transition to parenthood, whether they've biologically had a baby or whether they're caring for babies and infants. And we want to work with families to empower them to have the knowledge and skills, like the Icon message, so that in their most difficult times, they have the tools to be able to cope with that. So how do we do that within our service? Well, we share the message in multiple ways. We have multiple contacts with families. And, that is through both the mandated aspect of our service and with the additional offers that we have. So all families, irrespective of their circumstances, are offered our universal contacts, and that's at various points through the early years. So that would include obviously the antenatal period, but at the moment we're looking at our antenatal offer so that we can have more face-to-face contact with families, but we would share the Icon message with the signposting and information that we share with them when we say hello from our service during the antenatal period. Obviously we see them again at the new birth contact, and that's a key point because they've just made that transition to parenthood. So that's when they'll be potentially at one of their vulnerable pinch points. They're low on sleep, they're adapting to life with a new baby, they're getting used to the fact that babies do cry a lot, and that's completely normal as they adapt to feeding. If they have challenges with feeding, or there might be issues with things like colic or allergies, that can all cause more irritability in a baby, and that can be really difficult to manage, especially for those parents that are either not used to it or don't have a really robust support structure in place. But we recognise that, seeing them at the antenatal period, at the new birth visit, again at the 6-week check, and we do see them developmentally at 10 to 12 months and then again at 27 months. That's not always enough, because those are just a few, in that moment there's only 5 mandated contacts. That's not enough really to reach parents at every stage of a child's early years. And when we go out to visit families at home, that's 1 hour. They might not be feeling receptive to the messages. They might be tired, overwhelmed, they're not focused, because rightly so, they're focused on their babies. So we want them to know that they have open access to us, but we use other opportunities to be able to share the icon message. So that could be via our single point of access, which is also called SPA, or our texting service. So they always have open access via telephone for immediate support, advice and guidance. And we can share that message at that time during those phone calls, especially for those parents that are finding things difficult. But even if they're not, it's a good opportunity to share the message then. Or it might be via email. Parents can use our single point of access email address and we can share the message that way, via signposting when we send out any correspondence after a contact. So whether that's on a letter or a text message, but also parents text into our service. We have a text us service, which is where parents can ask for advice and guidance. It's not immediate advice and guidance necessarily, but it is another opportunity to have those discussions on the back of any discussions that you might have about feeding, about development, about how parents are coping, especially when you're having a discussion about emotional well-being and emotional health. It's a really good opportunity to share that message for parents that are struggling, to say, actually, if you are feeling tired, overwhelmed, low in mood, anxious, that it is okay to place your baby somewhere safe, step out of the room, step away for a moment, compose yourself till you're feeling able to go back, and be able to manage what's happening with the baby in that moment to reduce the risk of either shaking the baby or harming the baby. We also think about icon message during our record keeping, which I'll touch on a little bit further on in another one of the slides, but that's another opportunity for us to capture that information so that other professionals can see that we are discussing that message with parents at key contacts, and either they can then share the message in their service if thinking about system 1, where we record share with other health professionals, GPs, other agencies that are working with the family, and they can consolidate that message. And we also have internal promotion, again, which I'll talk about further on in the presentation, so that staff keep that message at the forefront of their minds in whatever they're doing, so that they can continue to use that as part of their toolkit. But the key consideration should always be that if families are reaching out for support or feeling overwhelmed, that they shouldn't feel judged, because it's by building those therapeutic relationships that we're really able to give that advice and guidance, and for parents to feel receptive to that advice and guidance. It's about them feeling that they have the resources and the resilience to cope in that moment, and only by opening up the conversation can we make them feel that that's actually the case, and then that they're not alone, and there are measures that they can use to help safeguard their babies and their own mental health at the time. So, it's really important that we use every opportunity that we've got available at our fingertips, and there are plentiful. So if we're looking at the key contacts, as I say, these are the key contacts with our mandated contacts, but also in our essential clinics and with SPA. If we're looking at where we would record those contacts, if we're thinking about record keeping after those moments have taken place, we have a couple of ways that we can do that. We use a sticker with the information and the icon message on it in the contact itself. So we place that in an area of prominence so that it's there and available for families to use. So if we're thinking about the promotional tools that Icon have produced themselves, one of the videos is an animation of a dad talking about how he's struggling, mum's not feeling well, he's come on from a night shift, baby starts crying, he's not sure what to do, baby's been fed, baby's been changed. I don't know where else to turn, and he thinks, I'm sure the health visitor left me some information. I believe it's a health visitor that leaves that information, and he gets his leaflet out and he looks at that information that's available to him, and that in that moment he realizes that actually it's okay for me to step away from my baby as long as they're somewhere safe and I can go and have 5 minutes to myself, have a bit of quiet, and come back feeling a bit more resilient. So we use a sticker that we place in the red book, the public child health record, little picture of it there. You must all have seen one, everybody gets one at birth or antenatally, and we place that in a place of prominence next to a sticker that also has our contact information, so that they're there and available as needed. On system 1, we have, so you'll see there, you might not be able to see it because the slide might not pick it up, but basically that provision of information about ICON, infant crying is normal, is in most of our mandated contacts for early years. So staff have to tick that box to be able to move on to the next part of the template, or to save that template. And so what that does is, like, those annoying messages that you get as pop-ups, they might seem annoying to staff at the time, but it means that they can't move on without recognizing it. And that's not only important to record the fact that you've had that discussion, but the action provides multiple benefits. It embeds that message for professionals so that the ICON conversation becomes a normal part of their daily key discussion toolkit. So there's the, everyone has their patter, everyone has things that they cover in contacts. They might be things that are part of the mandated contact, or they might be key pieces of information or evidence that they use whenever they go out to see a baby of a certain age or a child of a certain age. And that having that there, having to tick it, having to recognize that you've ticked it, means that you're constantly thinking about it. And that's what we want. We want that message to be at the forefront of everyone's minds when they're completing their records. I touched on it earlier, but that information is available to all the professionals using System 1 and reviewing that child's record. So that might be the GP, that might be other agencies that are working with that child. They might flick through that template and think, okay, so that's been discussed. And maybe I will discuss it next time. Or it might be that actually that message is not really embedded in their service as it would be, or they would like it to be. And so actually them seeing that, they'll think, okay, maybe I need to talk about that next time I see this baby, or a baby, or any baby, again, to put that message at the forefront of their minds. And it also helps us to capture data to determine how many people we're discussing this message with, and how often we're discussing the ICON message with families. And if those numbers start to drop, it highlights that actually there's a training need there that really we need to think about, whether we need to put that into our either our professional development sessions, bring somebody from ICON to talk about the ICON message, or whether, really it's just about us putting it again in our staff messages that come out every week. ICON is always embedded in our publications for staff, but do we need to highlight it again? Do we need to talk about it again? Is there an issue there that's stopping staff from being able to talk about it? And does that highlight a training need that we can meet within our clinical team to help improve that? Internally, we have a dedicated ICON page on our intranet within Cambridgeshire Community Services, which is accessible to all staff. And this sits within the safeguarding tab. So that provides an overview of the ICON message, links to the promotional videos, the website, our staff web page, and the 7-minute briefing, so that staff can refresh their knowledge, basically, because sometimes when you're asked to put stickers in a book, or you're asked to talk about something, or it pops up on a template, especially for new starters, you might think to yourself, I'm not really sure about this. What is the background of it? What is the evidence base? Why am I having this discussion? And there's plenty of resources and information on that dedicated web page that staff can access to be able to make them feel equipped to be able to have those conversations. Similarly, we have a toolkit that was created internally via our comms team, which provides links to the ICON information and is another resource available to anybody who wishes to promote the ICON message. And it's also really useful not only for new starters but for students moving through the service, so that they can then pick up that message and be able to use that information as they move throughout their training journey and beyond. It's never a bad thing if you pick up a piece of information, you go to another placement, wherever you can promote this key message is going to be valuable to families. And in terms of ICON week, so this week that we find ourselves in, we tried to take a more digital approach than last year. So last year we had some pop-up stands, tried to promote the ICON message with the use of some promotional bears. There were some issues with the bears, I'm not going to lie, they caused us a bit of a headache, but we went and did some pop-up stands in key places across Cambridgeshire and Peterborough, shopping centres, places of prominence, market squares, to promote that message. But this year we tried to take a different a different approach to the Engaging Dads theme, simply because staffing capacity within our service, and I know it's not just within our service that a lot of services are feeling stretched. We didn't want to make it challenging for staff to be able to get engaged in the icon message, so we took a digital approach to how we were going to promote it. So these little squares that you can see on the screen are the various elements of the promotion that would be rolled out this week on our social media. So that's our Facebook, our Instagram, other places where we promote digitally. You can see that a lot of them are based around male images, but not just male images. There's same-sex couples on there, but it's not exclusive to that. We recognise that even though the theme is engaging dads, that partners can come in all sorts of varieties, and we want to be as inclusive as possible. So a lot of the images are either of dads, including women, or just have the infant on there themselves, so that we're touching as many people as possible. And originally we had plans to do some videos of dads themselves talking about the icon message, and whilst that's been a real challenge to get volunteers, it's not that it's not going to happen, it's just not going to necessarily happen for this week. So I'm going to tell you a little story. We started big. We actually went to Clarence House and we tried to engage Prince William and ask him to do a promotional video. We're waiting to hear back from Clarence House, but it takes, as you can appreciate, a long time. But obviously that aligned nicely because he was the they were very closely aligned with Cambridge as Duke and Duchess of Cambridge. And we haven't had a no yet, we just haven't had it. So if that's going to come up at any point, we're going to be using that, as you can appreciate, all over our social media. We've also engaged local rugby teams and cricket teams, and the cricket team in particular has put it on their newsletter this week. The rugby team haven't recorded their video, but they are going to record their video. So we've got high hopes that that'll be in the next month or so. We'll be able to have a video up and running of them talking about their own experiences of fatherhood. That's the idea. And then the icon message at the end of that, quite informal, just so that they're accessible as possible to anybody looking at them on the social media page. And we also have some local dads that are using local child and family centres that are also going to record some videos. But unfortunately, the families that we'd engaged, some mums and some dads from the children's centre, had some car trouble and one of their babies became unwell, so they weren't able to record in time for this week, but they are recording as we speak at some point this week. So hopefully that'll be up and running on our social media soon. But these little icon images are going to be used repeatedly as part of the comms toolkit. So it's just another way of keeping that message going and keeping that message at the forefront of everyone's minds. So that's our kind of offer in a nutshell. Does anybody have any questions for me?
That was fantastic. Thank you very much, Lois. That was really good. Lots of things going on, and yes, please make sure you share if you do get the Cambridges involved. You know, we would love that, and all your other videos about dads. That they all sound fantastic, and please do share with us and share them on social media.
Yeah,
lots of different opportunities that you're using there.
Yeah, if we get Prince William to do a video, then we will be sending it your way, Sue, believe me. I mean, I know it's a long shot, but we thought, well, aim big and then whittle down as you go to what we can achieve. We did want somebody famous. We did want somebody recognizable. That was the idea. Somebody who was immediately noticeable on the social media page so that people would see it, take notice and watch it. And he hasn't said no. He's just very busy, as you can imagine. So we're waiting to hear back, but you never know. You never know.
That's amazing. Sue's got a hand up.
Hi, Sue.
Hi, Lois. So don't forget the founder if there is any sort of, meeting and
Oh,
greet.
absolutely not. It should be right in there. We'll be sending it your way, fast tracked through.
No, what I was going to say was as well, just on that, is that yesterday I emailed, the Prince and Princess of Wales have got a Royal Foundation for Early Years Centre Foundation, and I've sent a message to them about not just Icon Week, but just about Icon generally. So a two-pronged approach might work. I am just gobsmacked by and very humbled and very privileged to see what you are doing. It is just amazing. You are an inspiration, and thank you so much. I've got to say, I've been keeping my eye on social media. I'm not great on it. But I haven't seen anything. So you are tagging us, aren't you?
Yeah, they should be tagged. I mean, if you're not tagged, I'll speak to Monica in our comms team, because you certainly should be. There should be these little I don't know, call them files, posters.
Yeah.
They should be going out daily in different formats. So if you're not tagged, I don't know whether do you have your Facebook page? It's mainly Facebook. We're not allowed to use TikTok.
No.
We do use Instagram, and we do use Facebook a lot for our promotion.
Okay. I'll have another
I
look.
haven't seen them, Lois, either. So, but yeah, we have Facebook, and there's like at the bottom of the articles toolkit that you've got, there is like all the links for you to put them on. But yeah, please do.
Oh no, definitely. I'll speak to Monica via Teams chat after I've finished here, because I'm not sure why that would be the case, but she's definitely been hot on it this week. She had plans for a different one every day.
That's just amazing. It just brilliant. You are an inspiration, and thank you. This will be making a difference. There will be babies who will not be shaken as a result of what you're doing. So just thank you very much.
Oh, it's our pleasure. It's so important. It's so important, and it's so simple, because it does feed into discussions about safe sleep and feeding, and it runs through everything, doesn't it, really? We've all been there, and I think, like I say, it's about that non-judgmental approach, because let's be honest, that for those of us that have had children or been near children in any way, shape or form, there has always been that moment where that baby won't stop crying, and you do get to the point where you think, I can't listen to that anymore. What do you do in that moment? It's okay. No one's going to judge you if that baby's somewhere safe, and generally speaking, you can put them down somewhere safe for a few minutes and that baby will be fine.
I love your use of images as well. And we heard from, I was at a presentation at Leicester, an Icon Week presentation at Leicester earlier on today, and there was a gentleman there, they're planning some dad's videos, and they're finding it hard to get dads to say what they really feel, because it sounds like they present a risk to the baby. Do you know what I mean? If they say
definitely,
and they're really reluctant to say it. Well, they're reluctant to say it on camera, but they're happy to have their stuff read out by an actor and that kind of thing. So if you've overcome that, and maybe we can think of some ways of reassuring dads, that they can do it anonymously, like the videos that we've done. Those are dad's own words, but you can't place
with there's the ones with the actors are really powerful as well, that you created. We had one dad that came forward. Mainly the sticking point with anybody well known is that they wanted to be paid, and obviously we can offer some incentive, but it's not big enough for a celebrity, and obviously we are the NHS. But we did have one dad that who has been really keen on doing it, and the sports teams, I think because they're a collective, they were happy to engage in it as well. But it was about that kind of discussion. Our script that we provided them was very much just tell us what your experiences of being a dad were, and how you overcame that, and then talk about the message. So again, it's that there's no judgment here. It's how you cope and how you manage something that can be quite challenging, especially in instances like colic and any kind of milk allergy or intolerance or feeding issues. I mean, the list is endless. Babies cry, don't they? And it is stressful when you're tired.
And that the sleep deprivation is a new area that I think we're going to focus on as well for
Yeah.
the coming year. Just focus, especially, you know, how do you cope when you have had no sleep, and what does that feel like, and does it help just to talk to other people at 3 a.m. in the morning? We started it with our 3 a.m. club video, but it's something that I think we're going to take forward more dynamically in the next 12 months or so. So thank you so much. Brilliant. Thank you.
It's a pleasure. Thanks for having me, and thanks for listening, everybody. It's been a privilege.
Has anybody else got any comments before we go? For Lois?
No, thank you. Thanks for the little hands.
Oh, that's brilliant. Thank you, Lois.